Hello everyone. Today in this video we will try to learn ABGs. I'm gonna explain very simple trick. By using this trick in the exams you will be able to solve ABGs in less than 60 seconds. Before starting to learn the actual concepts of ABG, I just wanted you to know two things. One is acidosis, the other is alkalosis. One is acidosis. Generally what is acid? H plus ion contributes to acid. What is bicarb ion? Bicarb generally is alkali and it contributes to alkalosis. High HCO3 is nothing but alkalosis. Opposite, low HCO3 is nothing but acidosis. This we already know. Just see carbon dioxide in the body. It can form carbonic acid. So high carbon dioxide is nothing but acid. Low carbon dioxide is nothing but alkali. Okay, high carbon dioxide is acidosis, low carbon dioxide is alkalosis. If the acidosis is due to bicarb, that is low bicarb, then it is metabolic acidosis. If the alkalosis is due to low CO2, then it is respiratory component. HCO3 contributes to metabolic component, CO2 contributes to respiratory component. This is the basic thing which you have to know before learning ABG. Just observe what is the pH first. This is the first step you have to do. So first let me tell you the normal values. Normal pH is 7.35 to 7.45. Normal PO2 is 80 to 100 mmHg. Normal PCO2 is 35 to 45 mmHg. Normal bicarb is 22 to 26 milliequivalents per liter. This you have to remember. First in the question, just observe what is the pH. Okay. See, if it is, I am just giving an example. If it is 7.2, in first example we will take 7.2. Second example we will take 7.5. Sorry. 7.2. This is towards the left side of the range. That means this is abnormal. So you can say this as acidosis. Just do not observe anything. Just observe pH to label it as acidosis or alkalosis. Thereby you can eliminate two options already. Okay. Options will be in any simple case you will get metabolic alkalosis, metabolic acidosis, respiratory alkalosis and respi acidosis. So you have determined, by using the pH you have already determined that it is acidosis. So remove metabolic alkalosis and respiratory alkalosis. Now you have to decide if it is respiratory acidosis or metabolic acidosis. Okay. See, then observe what bicarb is. See, if the bicarb is 14, just you can say that this low bicarb can contribute to acidosis. So second step is observing what bicarb is. Then you have confirmed that you have confirmed by seeing bicarb that low bicarb can contribute to acidosis. So this can be metabolic acidosis. But you don't forget, you should not forget to do step 3, that is watching PaO2 and PaCO2. Say PaO2 is 80 mmHg, PaCO2 is 20 mmHg. Mainly you have to observe PaCO2. So in step 3 you could find that the PaCO2 is very low. First, basically less CO2 in the body means alkalosis, not acidosis. So here PaCO2 is not contributing for the acidotic component. This is in fact trying to compensate the acidosis by the compensatory mechanism. I'll explain the compensations in the later video. Now if I explain, it becomes complicated. So here This is pure metabolic acidosis. That's it. Compensations later, don't worry. You'll get to learn everything. In the second example, we are taking pH as 7.5. So, depending upon step 1, what we have decided, it is as alkalosis. No matter what PaCO2 is, no matter what compensation is, ultimately pH only will decide what it is, like alkalosis or acidosis. So, here it is alkalosis. So, 2 options already eliminated. Now, we have to identify if it is respiratory alkalosis or metabolic acidosis. Metabolic alkalosis. For that, step 2, what we have to do? We have to observe bicarb. See, if the bicarb is say 28, bicarb is 28, so high bicarb is alkali, low bicarb is goes to the favor of acid. Here it is high bicarb, 26 is the normal range, here it is high. So this can cause acidosis. Yes, there is metabolic alkalosis. Then we have to check if what respiratory component is doing. So we have to see what PaCO2 is. Okay, PaCO2 is 48. PaCO2 is 48. That means high PaCO2 goes under the component of acidosis. High PaCO2 is not contributing to alkalotic pH. So you can say that this is metabolic alkalosis only. In the third example, we have taken pH as 7.5, bicarb as 21 and PaCO2 of 25. So based on the pH, we have decided that this is alkalosis. HCO3 normal range is 22 to 26. So here HCO3 is low. If HCO3 is low, it contributes to acidosis, not alkalosis. But we have decided that the answer is alkalosis. So metabolic component is not contributing to that. So what PaCO2 is low. That means CO2 in the body is low. So this is contributing to respiratory component is contributing to alkalosis. This is respiratory alkalosis. Then one more example we are going to take. This is fourth example. pH of 7.1, HCO3 of 28, PaCO2 of 60 mmHg. PaCO2 of 60 mmHg. Here, by looking at the pH, we have decided that it is acidosis. Check if metabolic component is contributing to it. Bicarb though is high, so this is contributing to alkalosis. PaCO2 is very high, that means this acidosis is contributed by respiratory component. So the answer is respiratory acidosis. Okay, this is simple. This is simple, right? Now we will learn about compensations in each thing. Remember one thing about compensation. If there is respiratory acidosis in the body, kidney try to neutralize this acidosis by causing metabolic alkalosis. That means if there is respiratory acidosis means PaCO2 is high. PaCO2 is high in the body. So body doesn't like acidosis or alkalosis. Body always like normal pH. So body tries to neutralize this pH by activating kidney. So what does kidney do to neutralize this acidosis? It will retain bicarb. So it will increase the bicarb component. This is called compensation by kidney. Compensation by kidney. If the compensation is adequate, if the body is working nicely, then the compensation will be adequate and pH will also get neutralized. That means pH will also be in between the range of 7.35 to 7.45. If the pH is not normalized, that means body has tried to compensate but the pH didn't settle because the compensatory work is not sufficient. Okay. So in all these 4 examples, if we'll go to all the 4 examples again, you can find that compensation is not adequate. That's why pH didn't get neutralized. Again, we'll see all the examples. We'll try to cover with compensation concepts here. In step 1, we have seen that it is acidosis, bicarb is low, so this metabolic component is there for this acidosis, and PCO2, see already metabolic acidosis is here, no? So kidney, so respiratory alkalosis should be here. That's why PaCO2 is low. Body is trying to compensate by this if there is metabolic acidosis, what body does is body activates respiratory drive, like sending more carbon dioxide outside. If body sends more carbon dioxide outside, PaCO2 will be low. If it is adequate, pH should become normal, but here pH is still 7.2. So the compensation is not adequate. You can also tell this diagnosis as metabolic acidosis with partial respiratory compensation. With partial respiratory compensation, this you can see. Okay. First you have to decide what this is, then you have to see the compensation. Firstly, if pH is abnormal, then the compensation is not full, it's only partial. So here pH is 7.5, we have decided that it is alkalosis. HCO3 is high, so this is metabolic alkalosis. We have already seen that until this. Now PaCO2 is high, that means some acidosis component is there. This is nothing but compensation for metabolic acidosis, which is partial. That's why pH is abnormal. Okay, did you get it? Okay, we'll get back to this again. Now we will solve some problems. A 50-year-old diabetic man is brought to the emergency in drowsy state. His blood biochemistry is pH is 7.3, so it is mildly towards the left side, so you can decide that it is acidosis. We will go through stepwise. Our second step is seeing bicarb is 14, that means it is low, so metabolic component contributes to acidosis, yes. Then what about PaCO2? PaCO2 is 30, that means it is low. 35 is normal, so 30 is low, so respiratory has alkalotic component which is partially compensating, that's why pH is still 7.3. Okay, that's it. There is one more question here. What is anion gap? Anion gap is, you should not calculate potassium here, I am telling you beforehand. Positive ions minus negative ions. Don't add potassium. Sodium minus chloride plus bicarb. Negative ions sum plus sodium. The difference between them. Here 144 minus 100 plus 14. The answer is 30. Normal anion gap is 8 to 12. This is 30. So this is high anion gap. High anion, if there is one more clue. If there is high anion gap, definitely there is acidosis in the body. High anion gap always points toward metabolic acidosis. This is high anion gap metabolic acidosis. Generally, example of high anion gap metabolic acidosis is your famous DKA. Okay, some code mud piles. Okay, remember. Second question. 16-year-old schoolgirl came to emergency department from school because of acute breathlessness, agitated, tingling in her hands. pH is 7.5. See, this is alkalosis. Again, PaCO2 is low, so respiratory component is contributing to alkalosis. Low PaCO2 is nothing but alkalosis. High PaCO2 is acidosis. Here HCO3 is almost like normal to low range, so you can say it as normal also, normal to low. So there is no acidosis or alkalosis. There is no compensation. This is respiratory alkalosis. Third one. A 30-year-old man has weakness of all 4 limbs for 3 days. On inquiry, he has right loin pain. We will go through ABG directly. ABG is 7.2, mild acidosis. PaO2 is normal. Second step is watching this. So this is metabolic component of acidosis is there because bicarb is low. PaCO2 is in the normal range, in the normal to low range. So you need not think about anything about it because PaCO2 is in the normal range. You need not think about compensation here. Metabolic acidosis, acidosis it is. And you can calculate because they have given sodium, potassium, chloride and phosphate here, no? Bicarb here. So we can calculate anion gap here. 140 minus 110 minus plus, first we have to add this 140 minus 117, it is 13. So it's almost normal anion gap. Okay. 60-year-old woman presents with vomiting for 2 weeks. Her vomitus contain food particles. pH is 7.5. Again go through our steps. Alkalosis it is. Second step is HCO3 minus. It is 32. Normal range is 22 to 26. So it is high. Metabolic component, yes, it is alkalosis. HCO3 high is alkalosis. So metabolic component is contributing to it. Then what did they give? They did not give PaO2, PaCO2. They did not give PaCO2 actually. We have to check PaCO2 again for compensation. Already there is metabolic alkalosis definitely. We have to check even if PaCO2 is low. If I'm just telling you, I'm not confusing you. Watch here. If PaCO2 is low, then this can also be alkalosis. So it will be mixed metabolic and respiratory alkalosis. In case here, if PaCO2 is 20, in case if PaCO2 is here 20, then this alkalosis is due to both metabolic and respiratory components because PaCO2 is low. This is mixed. It becomes mixed metabolic and respiratory alkalosis. Okay, I'm just giving a pH 7.5. Again I'm explaining. PaCO2 of 20, bicarb of 32. Bicarb is high, that means alkalosis. PaCO2 is low, that means alkalosis. pH is already in the alkalotic. We have to determine the final diagnosis based on pH only. See, it is alkalosis. We have to see what is contributing. Yes, metabolic part is contributing. Yes, respiratory part is contributing. So this is mixed respiratory plus metabolic alkalosis. That's it. Okay. Then here one more last question. pH is 7.4 here. It is normal pH. HCO3 minus is also in the range normal. PaO2 is normal. PaCO2 is 40 normal. So first step is normal, second step is normal, third step is everything is normal, but the patient has uremia, vomiting in the morning. I have given the ABG report. So everything is normal in the ABG. You can tell if there is nothing given again, you can just tell that this is normal report. But they have given anions here. Sorry, let's calculate anion gap and see what happens. 140 minus chloride is 95. Bicarb is 25. First let's add these two. This is sodium, positive ions minus negative ions, chloride, and this is what? Bicarb, no? 95 plus 5 is 100. This is 120. So 140 minus 20. Anion gap is 140 minus 20 is 20. More than 15 is high anion gap metabolic acidosis. This is 20. So high anion gap. I have already told you that if there is high anion gap, you have to tell that this is metabolic acidosis. Even though everything is normal, but high anion gap shows metabolic acidosis. This is towards a higher range. You will not get such questions. You will get the similar questions like how we have discussed in the previous modules. This is ABGs for you. Now you can try to solve any ABGs of previous year questions. You will definitely be able to solve it. You can ask me any doubts if you have any doubts also. My Instagram handle is you can follow my Instagram handle, that is neatpg underscore usmle underscore facts. Okay, please do follow and DM me if you have any doubts, and also please like and subscribe my channel.